Inner West Council, and welcome to our online local information session in response to Inner West COVID-19. I'd like to start with acknowledging the traditional owners of the land, the Wangal people, the Eora Nation, and pay respects to their elders, both past and present, and emerging or wherever you may be today. I'd like to start today. We've got a few guests here to speak today. We have Dr. Teresa Anderson from the Sydney Local Health District. We've got Superintendent Sam Crisafulli from the Inner West Local Command. We've got Superintendent Al Sergi from the Commander of the Leichhardt Police Area Command. We've also got Sven Nilsson from Sydney Health District as well. So we're going to start with a few presentations. We're going to give everyone a chance to talk and run through that. I'd really like to thank all the agencies. It's been a great example of how we've been able to work local government and the state government agencies work together through this crisis. We hope you find today's information session very informative. I'd just like to say I'll give apologies from the Mayor, Councillor Darcy Byrne, who's been unable to join due to technical difficulties today, so I give his apologies. So first of all, I'll hand over to Dr. Teresa Anderson to give her presentation.
Thank you very much, Peter, and thank you everyone for having me speak tonight. I know it's a really difficult and challenging time for everyone. I will begin by acknowledging the traditional owners of the land, and for me it's actually the Camaragal people of the Great Eora Nation. I'd like to pay my respects to elders past, present and emerging, and all Aboriginal people who are online tonight. I'm actually joining you from the ministry, so I too had a few little technical issues, so I'll just fix my microphone so it works a little bit better. As I said, it's been an incredibly difficult and worrying time for us all and for our community. And I just wanted to say that we are all in this together. I know all of you in the community have been working really hard to keep each other safe. And I can tell you that we've all been working hard together. And one of the things that I'm most proud of over the last 17 months is how all of our local councils and government agencies and non-government organisations have come together with health to work really hard to try to keep our communities safe. And so I just wanted to take a minute to thank everybody and all of the people online for the amazing work I think that's occurred. And I know it's a really worrying time right at the moment, but I have great confidence that together we're going to beat this virus. We do know that COVID is spreading in our community, and this Delta strain is going very quickly. It spreads really quickly, and it doesn't need very much contact at all to spread. And so it's really important for all of us to remember that COVID can affect any of us, and it only sometimes requires a moment of contact. And so there's lots of things though that we can do to reduce the risk of becoming unwell with the virus and stopping the spread to other people in the community, to our friends and to our loved ones. And the basic things are really important here. So following the current stay-at-home orders, limiting our movements and not visiting others. And the good thing is we do have technology at the moment that enables us to communicate and keep in touch with each other. I think it's really hard when our loved ones want us to go and visit, but the best thing at the moment to do to look after our loved ones is not to visit. It's actually to use our other devices to stay in contact, you know, email, video calls, phone calls. You know, I've got a little granddaughter that I'd love to be able to see. I've got 4 grandchildren around the corner from me that I would really love to see, but I'm not, because I don't want to put them at risk. Wearing a mask whenever you go out is really important. And I know some people don't like wearing masks, but it does keep us safe. It's really, really important to stay 1.5 metres away from other people and wearing a mask. It does keep us safe. washing our hands and using hand sanitizers, and getting tested for COVID, even at the very first sign, the slightest symptom. If we get tested, that helps to protect us and protect the community. It's really important that when people are eligible, that they get vaccinated. We love vaccinating people, don't we, Sam? Sam knows that, you know, we've been very busy vaccinating all of our frontline workers and going through all of the various eligibility criteria. But we know one of the best defences against COVID-19 is being vaccinated. And as you know, the Commonwealth Government is working with the states to roll out the vaccine according to the availability in Australia and the eligibility criteria. And in New South Wales, we've already administered 1.2 million doses of COVID vaccine, and more than 500,000 of those have been administered by our district. Sydney Local Health District is responsible for the vaccination centre at Sydney Olympic Park, at Royal Prince Alfred, and we're also offering vaccinations at Sydney Airport and Canterbury Hospital for specific groups of our community. We're also reaching out to our highly vulnerable areas, such as residential aged care facilities, group disability homes and vulnerable communities, and particularly the workers in those communities. We've partnered with the Exodus Foundation to offer COVID vaccinations to some of the most vulnerable and at-risk people in our community, those who are homeless or at risk of being homeless. And we have a flying squad that Sven Nielsen oversees, of these amazing nurses that set up pop-up vaccination clinics all over the place. And we've recently done one at the church at the foundation in Ashfield. Vulnerable people in our community often face barriers to accessing main health services and have significant underlying conditions that often put them at risk, greater risk of COVID-19. And we vaccinated at Exodus more than 150 people the other day. So we've done a whole range of things to keep the community safe, and we've worked really closely with our colleagues in police and the other government agencies on the quarantine program, which starts before people come into the country, and then at the airport, and then in the police managed accommodation and the special health accommodation. And we have been really successful together in looking after returning travellers and keeping the community safe. And one of the things that I think we're most proud about in relation to our quarantine program is that it focuses not just on keeping the community safe, but very much looking after the individuals who are in our care during their period of quarantine. And we have lots of different protocols in place to keep the community safe from COVID-19, and I won't go through all of those today because we have lots of things that we want to talk to you about. But you did ask in your questions that you sent in a number of things which I thought that I would just take the opportunity quickly to answer. And one was around the use of QR codes. We had quite a few members of the community ask us about whether or not it's compulsory to use QR codes and how do we make sure that businesses do that. And they are required to under the public health order. And our health workers, in partnership with other government agencies, have been going around all of the businesses and retail outlets, organisations, to make sure that people are using their QR code. That really helps our contact tracers. If there is a positive case, that we can identify them quickly and help them to isolate from others in the community, and that's really protective. There's also a question about what we do with people who are COVID deniers or anti-vaxxers, and we all have a role in this. We keep educating people, and we're providing doing lots of work in the community where we know people are more skeptical about COVID-19 and the vaccination program, but we continue to work with those parts of the community and use trusted professionals like our general practitioners to encourage people to be vaccinated and for them to get a better understanding of COVID-19. And one of the things, if you come to Sydney Olympic Park or the RPA Vaccination Centre, we try to make it a really positive experience so that when people go home, they can tell everybody that being vaccinated is a really great experience and they're doing it for themselves and their families and, very importantly, for the rest of the community. And we're really grateful to everyone who steps forward to be vaccinated. And I'll finish just around exercise and walking your dog. So you can, under the public health order, the stay-at-home order, exercise and walking your dog is one of those things, with a mask, please, just in case you meet someone else along the way. Someone asked if you could walk your dog when you're in isolation, when you're a close contact, and no, you aren't able to do that. What we need to do is give your dog some things to do around home so that they chase their ball around the lounge room or wherever down the hallway. But please, if you're a close contact, we need you to stay at home and be isolated from other members of the family and loved ones, and very importantly, the rest of the community. I'm sure that there'll be some other questions that come up with our discussions today. But as I said, I'm just so grateful, Peter, and to Inner West Council for helping us with the Summer Hill drive through. That's just been absolutely amazing. And how many people have we had through there now, Sven? It's thousands and thousands. He's on mute.
Many thousands we've tested, and it's been a wonderful experience, very quick and efficient. And also the Roselle one, which is the Inner West Council as well, where they've provided immense support with the traffic management and that.
Yeah, so we're really, really grateful, and that's about the community coming together. So thank you, everyone, and I look forward to continuing to work with all of you.
Thanks very much, Teresa. It's been wonderful, wonderful to hear. It's been great to be able to work with the Sydney Health District and provide that facility at Summer Hill Depot. I'll now hand over to Sam Crisafulli, who is the commander at the Inner West Local Area Command.
Yeah, thanks, Peter. I'll start with a few words from Deputy Commissioner Mel Lanyon, who spoke with all our Central Metropolitan Police Area Commanders this morning, and the message is really police across the Greater Sydney area are continuing to focus on working with the community to ensure compliance with the health orders. And we know that southwestern Sydney has been a focus. We all would have seen that in the media, in the news. But that approach has been adopted across all metropolitan area commands. And I can say that in the Inner West LGA, so that's Inner West Police Area Command and Leichhardt Police Area Commands, we have about 16 police between us each day focusing specifically on enforcing the public health order, and how we're doing that is going around the businesses, the parks, the public places, and responding to complaints and from the public about people breaching the health order. Just a little bit of data over the last week from our cumulative 2 area commands. We've done 500 business inspections, just over that. We've attended nearly 300 complaints from members of the public about people breaching the health orders. We've issued 45 official warnings, that is, officially recorded on the system. 55 infringement notices for breaching the health order, both to individuals and to organisations. And unfortunately, 5 people just didn't get the message, and they've been criminally charged and put before the courts. And that is an extreme measure. We don't like putting people before the courts because our intent really is to work with the community. And because we all know that we can't police our way out of this. We've just got to work with the community. That's just that's the approach that has to be taken. We can't tell you how long we will continue to do this COVID compliance operation. As long as it takes is the answer, I suppose. This environment is very fluid, as we all know. I acknowledge that sometimes the changing rules are confusing. We work hard. We have police up late at night interpreting the orders and working with our health colleagues to make sure that all our police have got a good understanding so that we can apply the health orders. But really, where there is confusion, I suppose, we just really appeal to the public that the intent of the order is to restrict movement and to restrict contact of people. And that's what we ask for. So we ask that you help us with that. Really, the approach we ask from our police is just that we are balanced, that we are measured and tempered, and working with the community. I might just add a little bit from what Teresa mentioned about the anti-vaxxers and just following on from that. We have seen protest activity, particularly last year, around certain issues, some of them to do with the lockdown type rules. You know, New South Wales Police, particularly in this area, work really hard to facilitate lawful protests wherever we do, and we will continue to do that, particularly when we get out of this lockdown. But at the moment, it's not the time for public gatherings, and anybody who intends to come out in a group and protest, it's not one of the reasonable excuses to leave home. Okay, so you know. We totally acknowledge the right to protest and in Australia, and we work with you, but not at the moment in numbers in public. Thanks. A few questions specific to Inner West Police Area Command, and then I'll hand over to Alf. But what number to call if you wish to report a breach of the public health order? Crime Stoppers has got an extra capability at the moment. 1800 333 000 is the number to call. I had some questions about our police patrolling around the parks, people riding around at high speed on electric scooters. Look, some things are dangerous in COVID or not, and if we see somebody breaking the rules, then we're not going to turn a blind eye to that either. So I suppose the message is a lot of police out there, you know, enforcing the COVID rules, but at the same time, those police are capable and very willing to turn their eye to other types of crime as well. And the message is we've managed to do this without reducing our capacity to protect the community in other areas as well, which is an important message. Just one final question I received about a hotel in our command. I won't nominate the hotel, but the question was about a particular hotel in Enmore which has been playing music. And the person asking the question had some concerns about the lawfulness of that. That hotel does have a DJ operating in it, and look, we've attended that hotel. They're not actually breaking the law. They're not breaching the health order. They are allowed to play some music, and at the same time sell takeaway food and some takeaway beverages as well, which is what they're doing. If you do have any concerns about people gathering or the sound of the music, the noise of the music, then let us know. We will deal with it appropriately. I'll hand over to Alf now. Thank you.
Hello.
Thanks, Alf.
Yes, good evening. My name is Alf Sergi. I'm the commander of Leichhardt Police Area Command. Firstly, I'd like to thank the community, New South Wales Health and Inner West Council and all the other stakeholders in standing up to meet the threat of the coronavirus. This evening, I'll answer 3 questions from the community. Can I please preface my answers by saying that the public health orders can never be written in such a way that will be simple to apply in every situation. So it can be fluid, and you'd have to really look into the detail. Okay, the first question is, how can police determine whether individuals are blatantly flaunting the stay home health directive? Basically, the spirit of the public health order is to limit the number of interactions people have with each other. It also provides a number of reasonable excuses for people to leave their homes. Now, in answering these questions, police can only decide whether a person's breached the health order after they investigate it and obtain the evidence, which can be hard. But as you can see from the information Sam provided, we followed up with about 300 complaints and we investigate them all. But we need to deal with these on a case-by-case basis. Look, if a member of the community has evidence or information in relation to someone who's breaching the public health orders, Sam already provided the number with Crime Stoppers is 1800 333 000, and police will investigate. Another question was, how can police verify that such individuals are either essential workers or authorised workers? Now, the authorised workers really only apply to people who live in the Fairfield, Liverpool and Canterbury Bankstown LGAs, and these people, if they leave those LGAs to go to work, there's a whole list of them on the government website. I won't go into it, but look, if police pull over any people that are in our LGA, for example, they want to determine whether they're authorised workers, obviously they make inquiries by asking the appropriate questions and check the veracity of the information provided. If information is not correct and they tell us untruths, I suppose, then we can take the appropriate action. It's always up to the individual officer, depends on the individual. The police do have power if they suspect a person is breaching the public health order under the Public Health Act, section 112, to direct the person to state the name, address, and name and address, basically. So we do have powers. There's other powers as well, but I won't go into those. The next question was in relation to the use of skateboards and basketball courts with children congregating. Look, the public health order provides a reasonable excuse in relation to exercise and outdoor recreation, and this particular clause was designed to maintain the physical and well-being of people. They can't lock them up forever. They need to have a little bit of exercise time and recreational time, provided it's done the right way and within the spirit of the public health orders. The order does say that that more than 2 people can't be together. Those 2 people have got to be acting in a common purpose. So if you get 2 kids together, that's okay. But if 4 of them team up, decide to play a game of basketball, that could be a problem. So in that case, just call the police and we deal with the situation. The other question in relation to that one, it was a double-up question, was about wearing masks in these parks. Basically, there's no requirements to wear masks in the parks. Obviously, there's a recommendation if you're in crowded places and parks and streets to wear them, but that's only a recommendation. And obviously, it doesn't apply to kids under 12 years of age or 12 and under. And the final question was in relation to a person says whether they're asking whether they can travel to their creative studio to work in their own secluded place. And how could he prove that what he was doing and it's in a safe environment if he stopped en route? So basically, the public health orders allow you to leave to go to work if it's not reasonably practicable to do so from home. And the test in this case is whether it's reasonably practical. and it all depends on what equipment, what features of the creative studio you have that require you to do your work. In terms of proof, perhaps the photographs of your creative studio and all the equipment you need to do that sort of work. So like I said, the orders aren't that simple to apply in every situation. The police have to make judgment calls depending on what people tell them and what inquiries they make. So that's from me. My final words are that applying these public health orders in the past 15 months, the police have been measured and tempered in our approach, as Sam said as well. We apply the reasonable test when enforcing this compliance. So I'd like to thank the community. Your compliance has been outstanding. Unfortunately, there's always been a few people let us down, but they're the few, and the majority have been terrific. So thank you, and good night, everybody. Thank you.
Thanks very much. Thanks very much, Alf, and I do appreciate all the agency's time today. So it's important, it's wonderful how lucky we are to the enthusiasm and the collaborative approach from New South Wales Health and the police. And I think I can't imagine how busy they are to spend this time tonight doing that. So thanks again to Teresa, Sam and Alf, and also Sven for helping us out tonight. So in the case of, in respect to Inner West Council's response, we're providing a supporting role to our community and the local health district and the police departments. Last night, the councillors unanimously adopted a mayoral minute by Councillor Darcy Byrne, thanking all of the agencies and our frontline workers and the wonderful community, the NGOs we have within the Inner West for all the work they're doing. As a result of the mayoral minute, we're also exploring what financial support we can provide to the community. We're looking at that, and we're extending the use of the Summerhill Depot, which is a clinic at the moment until the end of a testing clinic till the end of September. And we're also noting there's a range of things that we've put in place. Council has an incident management team that's set up to respond to this, so we've responded quickly. We're not charging our sporting clubs during this time. We've got flood lights in the evening. We've got those on the evening for those that can't get out of work during the day and need to just get out for a walk. We're not enforcing any overstay parking in the residential streets, and we're using our social media channels to help promote the services that are available for you in the community. We're making sure we're collecting your waste, we're providing childcare, and we're making sure that we keep all our public spaces and our parks clean and open for you to use. So we're making sure that all the essential maintenance services required for public safety continue to operate. And our customer service team is available to take phone calls, and they're online to respond to your inquiries. So we've got a couple of questions that I thought I'd answer. So the first one is, I don't understand why the lights are on of a night time. This is encouraging future people to stop and talk to each other. They're just to extend for those people with it getting dark early, just gives people a place to walk around. And we haven't had many complaints at all about that situation. So we're doing that. That's important. The other question is, can rangers enforce people to wear masks, break up groups, or enforce the 10K travel limit? No, we're working with the police. If we see areas where people are congregating in things, we'll notify the police, but it's very much a collaborative approach where we work with each agency and do that. So on what ground, the next question is, on what grounds are council street cleaning staff exempt from lockdown? If they're not exempt, why are they working? Under the public health order, street cleaning is exempt and is considered an essential service for the maintenance and safety of the upkeep of our recreational services. And you've probably noticed getting around that our litter bins are getting very well used at the moment. So we've increased our service standards for those in busier areas such as the Bay Road and Camperdown Park. So, a few questions about the council services. Where can I find what services are operating and closed? We've actually, on our website, we've lifted the COVID button up. So when you go on our website, there's a link straight away to what's going on with council services, and it'll be a great link to all of the other services that are available. So a lot of helpful information about Service New South Wales, the public health order, how you can volunteer, where you can go for mental health support and services, and a range of community support services. So we make sure we keep the information up to date and amend it as circumstances change. So please go to that. And if you don't have access to that, call our customer service centre and they'll help you out. So another question is, I currently have a book on loan and I can't get to the library. Will this impact my account? no, we're not going to charge you for that. So we've paused our click and collect service in response to the latest public health order, and this includes the returns to our library. So please, please keep your items until the library opens. Will Dawn Fraser bars be open for winter swimming when lockdown is over? So we're delighted, when lockdown's over, we're delighted to announce that the heritage restoration works at the Dawn Fraser bars is now complete. Once restrictions have lifted, it'll be open. A wellbeing program will also be offered for those to experience cool winter temperatures. The next question is, when will the community nurseries open? They'll reopen once the restrictions are lifted and there are sufficient staff and volunteers to deliver the service. The next question is, what will happen if the council elections are still in lockdown? That's a good question, and I know our councillors are interested in that. The New South Wales Electoral Commission is responsible for this, and at this stage the advice we receive is that electors who can't get to a polling venue due to lockdown or due to worry about becoming infected can apply for a postal vote. If that postal vote hasn't been received within 8 days of the election day, the elector can use iVote either via the internet or the phone. Council will be sure to communicate all the details about the council election on our website, social media and newsletters. The next question is, what's the immediate plan to get small businesses back to normal trading? So I'd like to say that our Inner West business is impacted by COVID and the lockdown. We recognise that it's an incredible stressful period for you and your families, and we recognise that the small business is the heartbeat of our local economy. We're taking instructions from the public health order regarding the reopening, and we'll be providing a raft of measures to support the local economy. So measures include supporting pick-up takeaway, encouraging business to post on our website, which we then promote online. We've committed to post-lockdown communication and marketing to promote small business and precincts. Post-lockdown 2020, we undertook a local support local campaign, which will undertake a similar approach when restrictions are eased. We did set up via a resolution of council last year that we had an economic recovery task force. Out of that, there were a whole range of things that were put in place to support our businesses, and that was really it's been very supportive and useful for our local businesses. So we'll continue to do that. We're taking a more flexible approach with compliance, and property and business owners are encouraged to contact council to discuss this in more detail. What measures, the next question is, what measures are council doing to implement development, to make sure development assessment isn't delayed? It's a very important part of economic recovery. To stimulate the economic recovery, council's had a big focus on our development assessment. We've had our lowest median assessment process time since the Inner West Council established at 79 days for median assessment time. So we've been doing a lot of work with e-planning. You can lodge, and council assisted, where you can lodge all DAs online through the planning portal, and providing greater accountability in development applications, and making sure we've got an internal acceleration application to do our simpler applications. Our next questions, I'm concerned about the Inner West GP testing clinic in Elliott Street, Balmain. This is a respiratory clinic in Balmain and provides care for patients with a range of respiratory illnesses, not just COVID, which is just like going to another GP. We received feedback in relation to that about parking spaces. They originally had 6, we reduced it back to 3. If people are worried about that service, it's like any medical service that's within our LGA, but that service has actually provided some frequently asked questions at the bottom of their webpage. So we encourage you, if you've got any concerns, to have a look at that. Next question is concerned about lockdown and construction and extended hours of work. Can we stop these applications for 24-hour construction or extended hours? In June 21, the Minister for Planning signed a new order which allows construction work to occur from 7 a.m. to 5 p.m. on Saturday, and limited work from 9 a.m. to 5 p.m. on Sunday, which are outside of standard construction hours. And that prevails over any council policy. So we'll assess any application that comes on in accordance with that, and then we'll also publicly exhibit that so you can provide feedback. But we'll strive to ensure the amenity is maintained for our properties surrounding construction sites, but also noting the state government policies where we need to encourage recovery. What are other things beyond contract tracing and lockdowns that you can do as a community to keep the spirit up? As Dr. Teresa Anderson said, vaccination's the key to making sure that you keep safe during this time. But I think you need to connect, pick up the phone and connect socially. It's been a very important thing as part of the Inner West Council that we connect with each other in the workplace. But I think it's important that you do that and connect with people and just ring them up. If you're normally running to them socially or down the street, try and ring them, connect online. I think that's really important that we do that. So, and then the last one is I'd like to help my neighbours that are feeling lonely. And again, we just say that we want to reach out and connect in that space. So that wraps up all the questions we got during the sessions, and I just wanted to thank everyone who posted a query so much and appreciative. We didn't get to all the questions. We tried to do as many as possible. So thanks for joining us live this evening, and then let your family and friends know if you've missed it. We'll be posting a recording of the session on Council's YouTube channel and a link on Council's website. So at the end of the session, we'll be also posting a page of useful links of agencies and other people who can help or answer questions during this time. So we'll be updating regularly. So don't forget to hop on there. And finally, I'd just again like to thank all of the agencies, Dr. Teresa Anderson, Sven Nelson, both from the Sydney Health District, and Alf Sergi and Sam Christofouli from the New South Wales Police for joining us tonight. So thank you very much for your time, and I wish everyone a good night. Thanks a lot. Cheers.